Hi everyone, my name is Liang Jiarui, and today I will be presenting on computer technology in healthcare. Specifically, I will be looking at two technologies, electronic health records and AI-assisted diagnosis. I will cover what they do, how they benefit patients and doctors, and some of the serious risks and ethical questions they raise. Since the beginning of the 21st century, computer technology has fundamentally changed how healthcare works. We have moved from paper files and manual processes to intelligent data-driven systems. This presentation focuses on two of the most impactful technologies driving that shift. First, electronic health records, which changed how patient information is stored and shared. And second, AI-assisted diagnosis, which is changing how diseases are actually detected. Along the way, we will pay close attention to the social, legal, and ethical issues these technologies bring with them. So what exactly are EHRs? An electronic health record is a digital version of patient's complete medical history. Everything from diagnosis and medications to immunization records and allergies all stored in one standardized system. One of the biggest benefits is information sharing. Authorities medical staff can access a patient's full record instantly across departments and even across different hospitals. This makes emergency care faster and referrals much smoother. EHRs also reduce human error. Eligible. Handwriting has historically caused serious medical mistakes. Digital records eliminate that problems and help automate documentation, saving healthcare workers roughly 2 hours of paperwork every single day. Ultimately, EHRs provide the data foundation for clinical decision support systems, which help doctors identify risks they might otherwise miss, moving medicine from guesswork toward precision. Now let's look at the second technology, AI-assisted diagnosis. This team uses deep learning algorithms, the same kind of AI behind facial recognition, but trained on millions of medical images like X-rays, CT scans, and pathological slides. The way it works is through 3 steps. First, massive data training. AI models learn from annotated datasets to recognize patterns linked to disease. For example, a model trained on 100,000 lung CT scans can learn to spot tiny nodules that indicate early-stage lung cancer. Second, capturing subtle features. AI can detect things that are generally hard for the human eye to see, like abnormal cell shapes in a biopsy slide. Third, intelligent decision support. In practice, the AI flag suspicious areas and assigns a probability score, cutting diagnosis time from around 30 minutes down to about 1 minute. A well-known real-world example is Google's DeepMind. Their AI correctly recommended referrals for over 15 different eye diseases, including diabetic retinopathy in more than 94% of cases, matching the accuracy of top ophthalmologists. This kind of tool is especially valuable in remote areas, where specialist doctors simply aren't available. But EHRs also come with some serious risks. The first is data privacy and security. Because EHR systems store massive amount of sensitive data in one place, they are prime targets for cyber attacks. A single breach can expose millions of patients' names, social security numbers, and medical histories, leading to identity thefts and insurance fraud on a massive scale. A real example, the 2015 Anthem data breach, one of the largest in U.S. healthcare history, compromised the records of nearly 78.8 million people, and this is not an isolated case. In 2023 alone, over 400 healthcare data breaches were reported in the United States. The second major challenge is poor interoperability. Different hospital systems often use incompatible formats, so patient data can't flow freely between them. This creates information silos, and when critical information gets stuck, it can lead to misdiagnosis or delayed treatment. AI diagnosis also raises 3 significant ethical concerns. The first is algorithm-based. If the data used to train an AI model doesn't represent all patient groups equally, the model will perform worse for underrepresented groups. Research has shown that skin cancer detection AI trained mostly on lighter-skinned patients and has significantly lower accuracy on dark skin tones. This doesn't just reflect exact inequality, it scales it. The second issue is liability. When an AI system makes a wrong diagnosis and a patient is harmed, who is legally responsible? The company that built the AI, the hospital that deployed it, or the doctor who trusted it? Right now, there's no clear legal answer to that question. Third is what's called the black box problem. Deep learning models are extremely complex, and even their deployers often can't explain exactly why the model made a specific decision. For a doctor trying to validate an AI recommendation, the lack of transparency is a real problem, and it erodes both clinician and patient trust. Looking at the two technologies side by side, we can see both similarities and differences in terms of convergence. What they share, both EHR and AI diagnostics depend on large-scale data collection, and both are central to the ongoing digital transformation of healthcare. Neither can work well without the other, but they also diverge in important ways. EHR are fundamentally about managing and sharing information. AI diagnosis is about analyzing the information to support clinical decisions. The risks also differ. EHR faces threats around privacy and interoperability, while AI faces challenges around bias, accountability, and transparency. To wrap up, computer technology through EHRs and AI is generally reshaping healthcare, making it faster, more accurate, and more accessible. But technology alone is not enough. As we have seen, both of these tools carry significant risks that touch on privacy, fairness, and accountability. The future of healthcare isn't just about building smart algorithms. It's also building systems that are also ethical, transparent, and equitable. That requires technologists, clinicians, and policymakers working together, not just building better tools, but making sure those tools actually serve everyone. These are the sources I use for this presentation. Thank you, everyone.